Okay, so, you brought some pretty heavy stuff to our attention recently
Yeah.
with this analysis that looks at the state of public health funding in the US right now.
Uh-huh.
And it's a lot to unpack, and we really want to get into it and
Yeah.
try to understand what it means for all of us.
Right.
So, uh I guess the first thing is, we were talking about this a little beforehand.
Yeah.
It seems like there are two really big things
Yeah.
that stand out from this analysis.
Exactly.
The first is that, even before we start talking about funding,
Right.
there's already a pretty huge problem with mental health in this country.
A pre-existing crisis, you could say,
Yeah, that's a good way to put it.
just in terms of the sheer numbers of people who are struggling.
And then the second thing is that
Yeah.
when you pull back funding from something that's already in crisis,
Yeah.
that obviously has the potential to make things much worse.
It's not going to make things better, that's for sure.
Right.
And so that's what we're seeing here.
Okay, so let's start with that first point then.
Yeah.
The sort of pre-existing mental health crisis,
Uh-huh.
because the numbers from this analysis are pretty shocking.
Yeah.
It says that nearly 1 in 4 adults in the U.S.
Wow.
has some form of mental illness.
Yeah.
And that's 59.3 million people.
That's a huge number.
That's a lot of people.
It is. And that's before we even factor in the funding cuts.
Exactly.
That's kind of our baseline.
Right.
And what's important to remember, too, is that
Yeah.
for many people, this isn't just like a minor issue.
Right.
We're talking about serious mental illnesses.
Mhm.
The data says that's about 5.5% of adults.
Oh, okay.
So another 14.1 million people
Wow.
who are dealing with conditions that can really disrupt their lives
Right.
and often require like consistent, intensive support.
Yeah.
So, even before these cuts,
Right.
there are millions of people who are already being left behind.
Yeah.
And this is just going to exacerbate that.
Okay, so we're talking about mental illness in general.
Right.
But the analysis also breaks down some specific conditions.
Yeah.
And it's kind of interesting to see the numbers.
It is.
So anxiety disorders
Right.
affect 40 million adults
Wow.
every year.
That's a lot.
And then major depression in 2021 impacted 8.3% of the adult population.
So that's a significant portion of the population.
Yeah. And it's not just adults either.
Right. You mentioned children earlier.
Yeah. So back in 2016,
Yeah.
over 16% of kids and teenagers
Wow.
between 6 and 17
Okay.
had a mental health disorder.
So this is something that can start really early.
Exactly. And that kind of leads into another point from the analysis,
Wow.
which is that in 2021,
Yeah.
7.6% of adults
Okay.
had both a mental health disorder and a substance use disorder.
Right. So you're seeing the overlap there.
Yeah, so the analysis points this out, that these often happen together.
Yeah, they call them co-occurring disorders.
Right. And so that obviously makes treatment more complicated.
Exactly. You need a more integrated approach.
Right. Mm-hmm.
It's not just treating one thing in isolation.
Okay. And then, on top of all of this,
Yeah.
we had the COVID pandemic,
Oh, right.
which really just put a lot of pressure
Absolutely.
on an already stretched system.
Yeah, it was a real stress test for the system.
Right. And the analysis points out that we saw really high levels of distress
Yeah.
during that time.
Especially among younger adults.
Something like 58% of 18 to 29-year-olds
Wow.
reported feeling high levels of distress.
Yeah, so, it's not just these pre-existing conditions.
Right.
It's also the impact of recent events.
Yeah. And women and people with disabilities were also disproportionately affected.
Right, they were already more vulnerable.
Exactly. So it really just amplified all these existing vulnerabilities.
Yeah, it really exposed the weaknesses in the system.
Okay. So we've got this kind of backdrop of a system that's already struggling.
Right.
And then the analysis brings up this other really important point,
Yeah.
which is the treatment gap.
The treatment gap, right?
And this is the thing that I found really concerning.
It is concerning.
Because it says that over half of adults
Wow.
with a mental illness
Over half.
weren't receiving any treatment.
So they're just out there on their own.
Yeah, and that's 28 million people.
28 million people not getting the help they need.
So even before these funding cuts,
Right.
we're looking at this huge unmet need.
Exactly.
Yeah.
It's a system that's failing to meet the needs of millions of people.
So to put this in perspective then,
Okay.
the analysis looks back a little bit.
Yeah, a little historical context.
Right, and it mentions things like the world wars,
Oh.
the Cold War, the war on terror.
Right. Big global events.
Yeah, and how those events shaped government spending and priorities.
Those wars always have a big impact.
Right, and that includes funding for public health.
Yeah, sometimes it leads to more funding,
Right.
sometimes it leads to less.
And then it also talks about the impact of pandemics
Right.
throughout history.
Like the Black Death.
Yeah, the Black Death, the Spanish flu, HIV, AIDS.
And of course, COVID.
Yeah, and how each of these crises forced us to kind of reevaluate our approach to public health.
Yeah, because they exposed weaknesses in the system.
Right, and sometimes they led to big policy changes.
Absolutely.
And it's interesting
Yeah.
because the analysis points out that COVID,
Right.
which led to a lot of investment in public health,
Yeah, everyone was suddenly very interested in public health.
it's now being used as a justification for cutting funding.
It's kind of ironic, isn't it?
Yeah, the administration is saying that the pandemic is over,
Right.
and therefore we don't need to spend money on it anymore.
So they're using the very thing that highlighted the importance of public health
Right.
as a reason to cut funding for public health.
Which brings us to the actual funding cuts themselves,
Yeah.
which are pretty alarming.
They are.
So on March 26th of this year,
Okay.
$12 billion in federal funding
That's a lot of money.
for state and local health programs was revoked.
Yeah, through an executive order.
Right. So this was a very sudden decision.
Yeah, it came out of nowhere.
And the impact is immediate.
Absolutely.
The analysis goes into a lot of detail about this.
Uh-huh.
But basically, these cuts affect all sorts of critical areas.
Like what kind of areas?
Well, infectious disease monitoring,
Okay.
which we know is really important.
Especially after COVID.
Exactly. Mental health initiatives.
Right.
Addiction recovery programs.
Huh.
And just the basic infrastructure of our public health system.
So the foundation of everything.
Right. And the breakdown is pretty stark.
Okay. Oh, so
So $11 billion is being cut from the CDC.
the CDC.
Yeah, the Centers for Disease Control and Prevention,
Right.
which is like the main public health agency in the country.
Yeah, they're the ones who are supposed to be protecting us from outbreaks.
Right. And then another billion is being cut from SAMHSA.
SAMHS.
Yeah, the Substance Abuse and Mental Health Services Administration.
Okay, so that's the agency that specifically focuses on mental health and addiction. Wow, so those are big cuts.
And the immediate consequences are pretty serious.
Yeah, what's going to happen?
Well, the analysis says that public health officials
Okay.
are being told to stop grant-funded programs.
Immediately.
Yeah.
Like right away.
So they're just shutting things down.
Yeah, and we're looking at potential layoffs
The layoffs of who?
of all sorts of essential personnel,
Like who?
epidemiologists
Okay.
who track and understand diseases,
Right.
data analysts,
Yeah.
mental health professionals.
So the very people who are providing care,
Right.
that's a problem.
Yeah, the analysis even suggests that infectious disease teams could lose up to 90% of their staff.
90%.
Yeah, that's a massive reduction.
That's like losing 9 out of 10 firefighters.
Right, exactly.
So if there's a fire,
Yeah.
there's no one to put it out.
And on top of that,
Okay.
programs that are currently working to contain disease outbreaks
Well,
are being forced to shut down.
so we're actually becoming less safe.
Right, and this is all happening.
Because the administration is saying that the pandemic is over.
Right, the non-existent pandemic.
Yeah, but as we've been talking about,
Uh-huh.
there are all these other public health needs,
Right, it's not just about COVID.
especially mental health.
Exactly, and that's what makes these cuts so short-sighted.
Yeah, they're not looking at the bigger picture.
It's a very narrow perspective.
Okay, so let's talk about the impact on mental health specifically.
Okay.
Because that's one of the things that the analysis really focuses on.
Right, because it's a huge area of concern.
Yeah, so SAMHSA,
Hmm.
the agency that deals with mental health and addiction,
Right.
is facing some massive cuts.
Now massive.
Up to 50% of their staff could be laid off.
50%, that's half of their workforce.
Yeah, so think about all the mental health professionals
Go.
who could lose their jobs.
Yeah, that's going to have a ripple effect.
Right. And the analysis lists some of the specific programs that are at risk.
Like what?
Well, the 9088 Suicide and Crisis Lifeline,
Oh, wow.
which is a really important resource.
Yeah, for people who are in crisis.
Exactly. Then there are opioid addiction treatment initiatives,
Right.
which are obviously crucial given the overdose crisis.
Yeah, we're losing ground in the fight against addiction.
And then state and nonprofit mental health grants,
Uh-huh.
which support all sorts of community-based services.
Like counseling and support groups.
Exactly.
So those are all really important programs.
Yeah, and it's not just the direct cuts to SAMHSA.
What else?
The analysis also talks about changes to Medicaid,
Medicaid, right?
which could further destabilize the behavioral health system.
Yeah. How so?
Well, they're talking about things like block grants,
Okay.
work requirements,
Uh-huh.
and reduced federal oversight.
Right. So less money, less access, and less accountability.
Yeah, and that all adds up to less care for people who need it.
Exactly. It's a recipe for disaster.
So the potential consequences are pretty dire.
They are. What are we looking at?
Well, the analysis says we could see an increase in suicide rates
Oh, no.
as people lose access to crisis intervention services.
Right. That's a direct consequence of these cuts.
Then overdose fatalities could surge
Yeah.
as addiction treatment programs shut down.
So more people are going to die.
And then the whole state and local mental health infrastructure,
Right.
which is already struggling,
Right.
could collapse.
So it's not just about individual programs. It's
Right.
about the whole system.
Yeah, and these aren't just statistics.
Right.
These are real people.
Real people's lives.
Yeah, these are our neighbors, our families, our communities.
And we're failing them.
And then the analysis brings up this really interesting point
Okay. What's that?
about the administration's pro-life stance.
Oh, right.
Because, they call themselves pro-life.
Yeah.
But the analysis argues that public health funding is
man.
actually about preventing deaths
Right. It's about keeping people alive.
and supporting vulnerable populations.
Exactly.
So these cuts aren't just about fiscal responsibility.
Right.
They're an attack on public health.
And an attack on the people who rely on those services.
Exactly.
It's a contradiction, isn't it?
Yeah, it really makes you think about what it means to be pro-life.
Yeah. What does it actually mean?
Okay, so the analysis ends by talking about
Yeah.
the possibility of legal challenges to
Wow.
these cuts.
Because some states are looking into that.
Yeah, but the problem is that litigation takes time.
Right. And time is something that people with mental illness and addiction don't have.
Exactly. So while legal challenges might be a long-term solution,
Mm-hmm.
the impact of these cuts is being felt right now.
Right.
Programs are shutting down. People are losing their jobs.
It's happening as we speak.
And access to care is disappearing.
So what's the takeaway here?
Well, I think the analysis is making a really clear argument
Yeah, what's the argument?
that these cuts are prioritizing ideology over people's lives,
Right.
and they're going to make the mental health crisis in this country much worse.
Exactly. And that's a crisis that's already affecting millions of people.
So the situation is really urgent.
It is.
We need to do something now.
Because if we don't,
Yeah.
the consequences are going to be devastating.
Yeah, and they're going to be irreversible.
So we need to reverse these cuts.
Right.
And we need to reinvest in public health.
And we need to do it now.
Yeah.
Right now.
So this whole conversation has really been about
Yeah.
trying to understand the situation.
Right.
And I think it leaves us with this big question.
Okay, what's the question?
What does it mean for a society to say that it values life,
Uh-huh.
but then cut funding for the very things that support life?
Right.
Especially for the most vulnerable people.
That's a good question.
It's a question that I don't have an answer to.
Yeah, it's something we all need to think about.
And it's something that I think we all have a responsibility to address.
Absolutely.
So thanks for listening.
Thanks for having me.
And we'll see you next time
See ya.
on The Deep Dive.
Hey.